Hey guys, welcome back here today. Now let's see if I can't get this video kind of straightened up. Alright, so I'm going to kind of break down my exam number 2, which I took on, exam 2 for the nclex. So to kind of clarify some things, again, it's minimum 60 questions, maximum 130. You have 4 hours. This time around, this is my second go and I did pass. I had 80 questions. Like when I got to 60 and I was like, man, I know all this stuff. Got to 60, it's like piece of cake, right? And damn, it didn't happen. I was like, shit, I might have all 130. Clocked out at 80. I felt pretty good at my last question, so I said, well, I guess I figured out like the computer has agreed that, you know, I know my shit at least at a 95 percentile rate. It's 95% positive I know my shit. Anyways, digressing. I had 18 select all that apply. And you could pick one answer, or it could be all 5 or 6. So it could be all of them, or one of them, or somewhere in the middle. 9 times out of 10, it's going to be somewhere between 2 and 4, usually about 3. But I did have one that had to select all, and I did have one that I only picked one answer. Don't know if I got them right, but I do remember that. So 18 select all apply. If you listen to the Mark K lectures, Mark Clement, he says get to the hard questions. If you get a lot of hard questions, a good chance that you're probably doing a lot of stuff right. Or you're like me, you're getting all the easy ones wrong, and you're getting all the hard ones right, I guess. Anyways, digressing. That's what happened, I think, in my first exam. So some basic things to kind of go over. I actually wrote a little checklist down. Several of my questions, there are no clues. Okay, you either know what it's asking or you don't. All right, it'll ask you like what phylum is or something weird. I don't even know what it is. But point being is, it won't tell you like your patient has signs and symptoms of this. Which one of these prescriptions would you question? Like, you don't get that first part, so you don't even know if it's a drug or a symptom, or it could just be that you lack vocabulary, like me. So kind of note that, because they'll give you a lot of testing advice and be like, well, look into questions for clues. I had a lot of questions, there were no clues. It was just pretty much, do you know what this is? I had 5 pharmacology questions, 7 priority questions. So that was heavy on priority, and it was like you see 4 patients in the waiting room, which one do you see first? Other style priority questions may be delegation. I might kind of combine those two. Is you come on shift and these are your 4 patients, which one do you see first? Delegation would be like you are a nurse newly assigned to ER, or you're from OB or something, which one of these patients should you see? Alright, I had 3 ethics questions, I had 4 mental health questions, I had 0 cardiac strips on this one, so I had no cardiac strips on this one. My first exam I had 2. I had 3 questions on the same disease. It pretty much asked the same thing. I know I got 2 of them right, and I know I got the last one wrong. So don't know why the computer kept asking me about, I think it was Guillain-Barré syndrome, which is a neurological disease, degenerative disease. That's the one I got wrong. I was like thinking for some reason that it was respiratory. Anyways, digressing. I did have 3 questions on kids and pediatrics. I had 2 on pregnancies. I didn't have any on fetal heart rate or anything like that. Excuse me, I had 0 math questions on this one. I did use my calculator once, don't remember why, but I did have 0 math questions. I had 3 put in the correct order, and for me, they were all on NG tubes for some reason. 2 on entry and 1 on exit. They were all worded slightly different, so kind of note that. Big things that I use to study. Here's my biggest piece of advice. You need to use UWorld. Okay, UWorld is an online kind of test questionnaire bank, but it's not just any style questions. Pros and cons of UWorld I will probably do in another video in depth, but here's the long and short of it. I do believe it helped me the most. You pay the most. I think I paid like $170 for 3,000 questions and 2 practice tests. On my practice test, I scored 58s both times, which was a high percentage of passing nclex. And I took, I think, about 1,800 questions over the course of 40-something days. You got to read the rationales. That's where the money is. Read the rationales. Understand what they're talking about. The UWorld questions are different than nclex. nclex says them very straightforward. Like, what is this? Every now and then it may go like 1 or 2 levels deep. Like, if, you know, the hypothalamus is excreting this, what will it affect? Blah, blah, blah. So, you know, something weird like that. However, UWorld is like usually 3 to 4 layers deep. Like, it'll ask you some obscure thing, and somehow you're supposed to connect that 3 levels down and figure out, oh, you stub your big toe, turns out you have, you know, kidney disease or something crazy. That's probably not true, but you get the idea. And I think that's where it could be a hindrance. Just because something is harder does not mean that it is helpful, okay? But what it does test is depth of your knowledge. And that is good for you to have depth of knowledge. What I hate about it from a test-taking standpoint, especially on nclex, is you can overthink it. All right, this comes from me. If anybody who ever met me, if you get me sitting down too long with too much time, I will overthink things. Hence, I did not make it on my first go at nclex. When my professors found out that I did not pass my first nclex, they were like, "You overthought things, didn't you?" And I was like, "Yeah, I guess I did." They already knew it. So you can't overthink things. Go with what you know. UWorld, though, is great on the testing bank and great on rationales. It's got some pretty okay pictures. Because when you buy it, you're like, this is so simple, why do I need this? It's because of the content. It is more structured, kind of like nclex, but it's not exactly the same. Okay. So no matter what you hear on the internet, in my opinion, it's not the same. But it is close. Okay, it is close. But I do like the rationales. You got to pay attention to those rationales. Read them, learn them, understand them. Pay attention to all the highlighted words, all the pictures, etc. Next on the list is Mark K. Listen to his lectures. I did listen to his lectures before my first exam, and I think it helped me, but it would have helped me more if I knew it 2 years ago in nursing school. So listen to it as soon as you can. Pay attention to it, but don't use all of his strategies on the current nclex. Okay, some of his lectures that you find on the internet are like 10 years old, so not all of it's still valid today. But listen to it, understand the, I guess, the principles, okay, of what he's trying to say. That's important. Get to the hard questions, talk about that. The other thing I used a little bit of was the Remark Quick Facts book. I would recommend it. It's $20, and the pharmacology on there was pretty good. Everything else was just like, good facts. Going back to Mark K, he's got the 35 questionnaire book that goes on his lectures that are online, and the blue book, which got like 2,000 factoids you need to know. You need to know those 3 things. It's just very helpful. Other things I have used, I used free videos of Remar online. I used it was shitty. I didn't like it. Whoever the nurse is, just like 2 hours of her blabbing and just going crazy, to me, you know, was just not helpful to me. It was more like a pep talk. Anyways, digressing. I use Medical Destiny for a lot of questions. I would just like be eating my food, shoving food in my face, and be listening to questions. And they did provide rationales. That's on YouTube. It's free. What else? I tried some Hearst reviews, like call-ins. Oh no, I'm sorry. Maybe was it Hearst reviews? Like sit-ins on 1 hour on voice on phone kind of lectures. They sucked. So I wouldn't pay for it because the free ones were shitty. ATI, I spent 2 years doing ATI in school, and long story longer is, other than the pink book, it's all shit. Unless you got enough time to be like a librarian and read that shit and research all the words that it doesn't give you as information, or go on their online books, which is a pain in the ass to navigate. I'm going to go on a rant later on about ATI. It was useless. Digressing. So anyways, UWorld, Mark K. I'm not sponsored by any of them. I paid out of pocket, and I still will pay out of pocket, and I would recommend them. Good luck. Don't underestimate yourself. Don't underestimate the exam. Be smart. Thank you, guys.